Milestones and Momentum, Maternal Mental Health and Suicide Prevention Congressional Reception. We're so glad all of you are here. Before we get started, I'd like to see by a raise of hands who's from a congressional office. If you're a staffer, thank you for being here. What about an agency? I think we have guests from HRSA and the CDC. I know we have a speaker from SAMHSA. Do you have any agency representatives here? Okay, great. National nonprofit partners, if you could raise your hands, or local nonprofit partners, welcome to all of you too. We all know it takes a village to do this really incredible and important work for mothers. My name is Joy Burkhardt, and I'm the Executive Director or CEO of the Policy Center for Maternal Mental Health. You might be asking yourselves, well, who are you? I wanted to share that we are a nonprofit policy think tank and field catalyst. What does that mean? We are attempting to inform and facilitate systems change in the health delivery system and also through community-based organizations so mothers, children, and families all have the best opportunity to thrive. So we issue reports and fact sheets, some of which are on the tables in the room today, including a report on the role of Medicaid, for example, in supporting maternal mental health. There's also a report on rural maternal mental health. So I wanted to remind all of you, I think some of you have seen these statistics before, but we call this maternal mental health by the 20s. We want to remind you that 20% of women will suffer from a maternal mental health disorder, and that there are a range of disorders. So we hear about postpartum depression most often, right, in the news media. It's not just the postpartum period, and there's a range of disorders of anxiety. You might hear about postpartum psychosis, maternal OCD, something we really need to pay attention to. Less than 20% of these women are screened to detect these disorders through a valid questionnaire, for example, like the PHQ-9 or the NBERT, and then less than 20% will receive the treatment that they need to become well. We also wanted to share, this is international data, that roughly 20% of maternal deaths are due to suicide. The CDC actually just released new maternal suicide data and maternal mortality data last week, so we are going to be sharing that in our upcoming issue brief shortly. So we wanted to celebrate some of the milestones, and I want to recognize the Maternal Mental Health Leadership Alliance, who has been doing incredible advocacy on maternal mental health work that they've done in this space, including helping to stand up the grant for perinatal psychiatric consult lines. Those are consultation lines that are provider to provider, like OBGYN to psychiatrist consultation lines. Those are administered, those grants, through HRSA. The CDC, of course, many of you know, we'll hear from members of Congress this evening about their work to ensure that maternal mortality review committees are working on all issues related to maternal mortality and morbidity, including maternal mental health and maternal suicide. And then HRSA's maternal mental health patient or public hotline, the Maternal Mental Health Hotline, championed by Maternal Mental Health Leadership Alliance here in the room, of course. SAMHSA has also for quite some time been working on a program called Pregnant and Postpartum Women that recognize the need to address substance use disorder as well, not just traditional mental health disorders, and provide grants to states to stand up residential treatment centers to support substance use disorders. So despite all this incredible progress and awareness building that's happened in the United States, we still, as all of you know, have so much more work to do to support prevention, payment reform, and planting even more treatment programs here in the US. To that end, we wanted to share that we were really committed to help write the legislation that called for the formation of the Maternal Mental Health Task Force that was signed into law by the first Trump administration, right? President Trump in his first run as president, and also then stood up under the Biden administration by the Office of Women's Health and SAMHSA. The report was released to Congress, including a national strategy, just about 18 months ago. And we want to make sure you knew about that, especially members of Congress. We're eager to work with you on some key points. So I wanted to share a couple of big ideas before we introduce our members of Congress this evening from this report. And these are big ideas that the Policy Center has teased out as items that we think could be elevated and addressed under this Congress. First, we wanted to share this concept of provider-to-provider psychiatric consultation. As we've talked about already, there are grants to states, and states are standing up those psychiatric consultation programs. We really strongly believe that these consultation programs should be available in all states. And so we're urging our partners and Congress to think about what this could look like, perhaps piloting a national program where funding goes to the existing state programs to also support states and other jurisdictions that don't have the capacity to stand up these lines. And also maternity care clinics as infrastructure. So many of us know that we have shortages of OBGYNs, hospitals with maternity care units are closing. March of Dimes, thank you for your work making all of this so visible to all of us. The task force report shares that there's a critical need to address these deserts, and this is also maternal mental health prevention to make sure that we have access. You can read more about our big ideas, pulling them out of the task force on our website. And without further ado, I first want to thank our sponsors and partners. So Maternal Mental Health Leadership Alliance, the Zero Suicide Institute, we'll hear from Julie in just a moment, and also the American Psychological Association and many other partners that are, of course, very committed to maternal mental health, and our sponsors are here as well. And we do have members of Congress here in the room, so before we ask Megan to make her remarks, I'd like to welcome Congressman Ryan McKenzie, representing the 7th District of Pennsylvania. McKenzie, please come on up and join me at the podium. And thank you for your ongoing commitment and new commitment to maternal mortality.
Well, first of all, thank you everybody for joining us this evening as we discuss this important topic and find ways that we can actually improve maternal health across the country. And so it was about back in 2018 when I was a Pennsylvania state representative. I had read an article about the increased maternal deaths across the country, just shocking statistics and how we fared against other developed countries. But an interesting thing stuck out to me was that for a long time the problem was not being recognized because of the work that was being done in California. And so they were leading the way in maternal health, and they had a maternal mortality review committee that was providing recommendations. But that, because of the size of California and their results in improving their outcomes, it was actually confusing the data nationally. And so people thought for a long time that the situation was getting better, but then when they figured out you had to take California out of the equation, you realized that the rest of the country was actually getting worse. And so I decided to look at what California had done as a model for Pennsylvania, and so I was proud to champion the Maternal Mortality Review Committee legislation at the state level. Ultimately, we got it passed, signed into law, and then got set up, and now after a couple of years of data, we've been actually able to start promulgating recommendations and actually advancing legislation out of that. So during my last session in the state legislature 2 years ago, we started advancing legislation to provide the increased coverage through Medicaid and other private insurance for doula coverage, for blood pressure monitors, for all kinds of things. But the work, as we know, there is no silver bullet to this. It's all kinds of, it's a multifaceted problem, all different situations, and so you're continuously trying to address the different issues. And so appreciate the work that you're doing here tonight by bringing up mental health and suicide as a leading contributor to maternal health deaths and challenges that we face. So this work continues, and so as a member of Congress, I was proud to co-sponsor legislation, the Preventing Maternal Deaths Reauthorization Act, that would provide funding to continue that MMRC work around the country, because one of the factors, even though it shouldn't have been, but one of the factors that we faced in Pennsylvania to make sure that we could advance that legislation was cost. Just like everything in every budget in every state across the country, they're facing challenges with their state budgets, and so the fact that we were able to say as one part of our case that this would be at no cost to the state of Pennsylvania was one of the things that helped ease this path to implementation. So we want to make sure that we continue that here in Congress, along with all of the other things that would come out recommendations that would come from work like yours. So just want to say thank you for the advocacy that you're doing here by joining us here in Washington, D.C., and look forward to continuing to work with all of you as we champion the cause of maternal health across the country. Thank you again, and enjoy the
Well, thank you, Congressman McKenzie. Do we have Congresswoman together with us this evening? There you are. Next, I'm so pleased to ask Congresswoman Diana DeGette from Colorado's 1st District, a Democrat, to join us at the podium to share her committee.
Thank you so much, and I'm really happy to be asked to come and speak for a few minutes because I've been working on these maternal health issues for a long, long time. And as all of you know, the U.S. has the highest maternal mortality rate of any high-income nation. And the data bears out that women and families of color are particularly vulnerable. 80% of maternal deaths are preventable, but we can't address a problem when we don't know the root causes. And in 2018, I was the Democratic lead when we passed the Preventing Maternal Deaths Act into law under the first Trump administration. I'm happy to see my colleague, Congressman McKenzie here, who is taking up the mantle for the next generation of Republican leadership. Among other things, the bill authorized the CDC to support maternal mortality review committees, so we actually have the data to make science-based public policy and to prevent pregnancy-related deaths. And I was shocked when I first started working on this bill before we passed it in 2018 that many states, as Congressman McKenzie alluded to, many states don't even have the data that's broken out by income group, by race, by other issues, to be able to come up with a comprehensive national policy. And that's why this was really successful, but it's also why we need to renew it. So I'm really happy that my colleague has stayed here. This is not intended as anything against you, but we've introduced this bill. The bill was successful. In fact, just showing how bipartisan I am, I have a framed copy of the bill signed by Donald Trump from the first time that he was president. And yet, in this Congress, it has gone nowhere. So I'm putting it all on you to help it get passed. And I'm also putting it all on everybody else to let your Congress people know how important it is that we pass this legislation so we can continue to work with the states, that they can update their reporting systems, and so that we can actually get the data we need to do comprehensive legislation. Because truly, we cannot fix a problem until we know exactly what that problem is. And the other thing that I can't help but mention, because as I say, CDC is taking the lead with the chaos that we're seeing at the CDC right now, with the firing of the director a couple of weeks ago, with the resignation of many of the senior officials, and with the terrible morale that they have down there, not to mention the funding cuts that we've seen. I fear that programs like this program are the ones that are going to lose out. And so this is something I think we can work on in a bipartisan, bicameral way to make sure we continue the funding to get the data we need. As the Congressman also pointed out, once you get that data, if you can prevent bad maternal health outcomes, including in mental health, and also other types of outcomes, it actually saves the system money. So if you put the initial investment in, it will save money in the end. So this year, I'm happy. I'm the ranking member of the Subcommittee on Health of the Energy and Commerce Committee, and I have many good allies on both sides of the aisle, but my most important ally is advocacy groups and constituents like you. So thank you very much for everything you do. Thank you for standing up for science. Do not be afraid to speak out and to educate your members, because we really need to get this done. Thank you so much.
Thank you, Congresswoman DeGette. I am now wanting to invite our sponsors and another guest to the stage. First, I want to invite Megan Gilmore, for Vice President of Government Affairs at the Association for Behavioral Health and Wellness, a group of payers that are committed to moving the needle in maternal mental health. Invite you up, and Dr. Julie Goldstein, if you can come up as well to make brief remarks about your commitment through the Zero Suicide Program. Megan.
Thank you. Good evening, everyone. I'm Megan Gilmore with ABHW. ABHW and our members know that a mother's well-being is foundational to a family's health and mental health. And we are so excited to co-sponsor tonight's reception. Glad that all of you are here today to talk about these really important issues. And we're really looking forward to beginning our partnership with the Policy Center for Maternal Mental Health. So again, thank you, everybody, and look forward to it.
So really a pleasure to be here. I'm Julie Goldstein-Grummett. I'm the director of Zero Suicide at the Education Development Center. And it was just about a year ago that I was in this same building at a congressional reception where we were celebrating the launch of the nation's national strategy for suicide prevention. And one goal put forth in that national strategy is to implement effective suicide prevention services as a core component of healthcare. And that's everything I think that we're talking about tonight. We know that commitment to using the zero suicide model is an effective way to achieve this goal, and it's an important tool in promoting maternal mental health. And one thing I think that I'm hearing continuously is that we absolutely have to ask people directly. We know that 75% of individuals who die by suicide have seen a healthcare provider in the year before their death. Perinatal women are frequently seen by providers, often during this time, and this provides multiple opportunities to do screening for their suicide risk and then to deploy interventions. Early intervention and care by these providers who they trust and they know is really better for the mom, it's better for her children, it's better for her family. And this is what the heart of Zero Suicide is, that any healthcare door is the right door for somebody to be identified as at risk for suicide through standardized screening tools, and then reduce that risk through our evidence-based clinical interventions that we know work, and most importantly, by offering hope that gives people the opportunity to both survive and thrive. There's decades of research on suicide care practices, but they're really underutilized, and maternal mental health is really the next frontier in zero suicide efforts. So it's really an honor to be here and get to partner with the Policy Center, and I'm really looking forward to learning more about the work of others in this room and partnering with you, so thank you.
I'm now really pleased to recognize Dr. Rick Lambert, a senior advisor at the Substance Use and Mental Health Services Administration, SAMHSA, for his commitment to maternal health, mental health, and all things. We really see a great partner in SAMHSA, so thank you, and we're so glad you're here. I also wanted to quickly recognize Dr. Nima Sheth is in the room as well. Raise your hand. Nima worked under the Biden administration with SAMHSA and helped facilitate the work of the Federal Maternal Mental Health Task Force. So thank you, Nima, to you for laying the groundwork, and Dr. Lambert, we're so glad you're here.
Thank you. Hi, everybody. Nima, I want to thank you too. I haven't met you yet, so I guess we should talk afterwards. Thank you, Joy. Good evening, everyone. As Joy said, my name is Rick Lambert. I'm a senior advisor and a physician. I'm with SAMHSA, Substance Abuse and Mental Health Services Administration. On behalf of Dr. Art Kleinschmidt, who's our Principal Deputy Assistant Secretary, and myself, I want to thank the Policy Center, of course, for maternal mental health, for the opportunity to be a part of this important event. And Congressman McKenzie and Congresswoman DeGette, I guess, have left, but I want to thank them as well. As a co-lead of the Task Force on Maternal Mental Health, SAMHSA looks forward to working with you and everyone here tonight to support the well-being of our nation's mothers and their children, families, and communities. Technical. introduction. All right, thank you. This is not
Take two.
technical. Yeah. Take two. So a little about myself. I've been a practicing physician for over 40 years. Over 20 of those years were in emergency medicine, my primary field. Then I did physical medicine acupuncture. I treated thousands of women over the years, including mothers and mothers-to-be. I'm aware of how often mental health and substance use conditions that affect pregnant and postpartum women go undetected and untreated. And like you, understand the vital need to address this ongoing challenge. I started in government work just under 7 months ago, so I'm a newbie here, and chose SAMHSA specifically because of my desire to serve by addressing mental health challenges. Primarily as those relate to veterans, and to work for the advancement of emerging therapies such as psychedelic-assisted therapy, for which I trained, for PTSD and major depressive disorder, including suicidality. I know and understand the potentially transformative power of these medicines when utilized in a safe and effective way. And for me, mental and emotional health is the basis of all health. And maternal mental health is certainly right at the top of that list, because when you think of it, that's where it all starts, that's where we all come from. So the work this task force is committed to is also personal to me. I have 2 daughters. One got married 14 months ago, the other is getting married in 5.5 weeks, so I have a lot going on. And I know that they plan to start families and be mothers in the very near future. Like all of you here today wish for those you love, I too pray they have healthy and happy pregnancies, and that their joy continues into the postpartum period and beyond. But we all know that too often it doesn't go that way. So I want them and everyone to have strong supports for maternal mental health available where they are treated holistically, both body and mind. And that's why coalitions like this are so important. It's the people in this room who have kept the momentum going and gotten those hard-earned wins for maternal mental health. So we look forward to supporting that momentum. We really do at SAMHSA. Maternal health and supporting women, children, and families is central to the administration's Make America Healthy Again initiative. I want to close by mentioning that September is Suicide Prevention Awareness Month, and yesterday was 988 Day. So we hope to continue spreading the message this month and all year that suicide is preventable, as has been said, and that there is hope and that there is help. We rely on you to help spread the word about this incredibly important resources like Maternal Mental Health Hotline and 988. 988 has now been contacted over 17 million times, so thank you for all the support, and it's saving lives. We also have findtreatment.gov, I don't know if any of you have heard of that, for people who think they may need help but don't know where to start. With that, I'll wrap up my time here. I look forward to hearing your stories and ideas on how we can do better at the federal level to support maternal mental health. Thank you again for your partnership and support. It's so important.
It's been an awesome lineup so far, and I wanted to say that we perhaps have saved one of the most remarkable speakers for the end, so we're so glad that you're with us still. I now want to invite Stephen D'Achille to join me at the podium. Stephen D'Achille, as you will hear tonight, has experienced an unimaginable loss in losing his wife to maternal suicide. He is also the founder of the Alexis Joy D'Achille Foundation for Postpartum Depression and has done some incredible work creating new treatment programs, promoting access to new novel drug treatments, and more in his home state of Pennsylvania. And we really recognize him and the work that he's done as absolutely essential and a model for the rest of us across the U.S. So Stephen, without further ado, turn it over to you.
She set the bar kind of high there. The picture you guys see on the screen was taken October 7th, 2013. My daughter was 5.5 weeks old. And that's the last picture ever taken of my wife. The following morning, I woke up and something was wrong, and I walked downstairs and my daughter was strapped to that same changing table. I couldn't find my wife Searched the house high and low, I couldn't find her, and I did a double take, I went back to the basement, and I found her unresponsive in the basement. And so I called the paramedics, and they were able to, bring a heartbeat back, and she spent the next 2.5 weeks out of intensive care. But I knew she wasn't gonna make it because her neck was broken, and they told me she wouldn't make it. But it was during that time while she was in intensive care, and I remember looking at her, and she looked perfect, she looked beautiful. You couldn't tell anything was wrong with her. But I knew she wasn't gonna make it. It was so crystal clear in that moment. And I remember looking at her thinking, like, how unfair. She was not like most women that suffer with this, that she suffered in silence. She was very, very vocal with everybody and everyone about the struggles she was having. And it became really obvious. And so I set out to build the facility that I believe, if my wife had access to, would have saved her life. For the last 13 days of Alexis's life, we went to 7 different healthcare facilities, crisis centers. She was like red flagged in every system, that she was in a very bad way. Those options, I'll give you 3 stories, 3 different instances where we saw care. One was at it was at an ER with a psychiatrist on call that had an inpatient unit, and we went in, and she looked beautiful, and it was our 4th wedding anniversary, and she was upset because she couldn't go to dinner or put her heels on, and she didn't think she deserved her gifts, and I deserved more than her. And we went to the hospital, and no one knew what to do with her. And we went from floor to floor, and we ended up in a glass room that locked from the outside. And there was a social worker talking to her, and then a doc came in and talked to me. And I'm talking to the doctor, and she's telling him she's having suicidal thoughts. And his answer to me is, hey, listen, she's gonna be fine. Women like her would never take their life in a sloppy way. Women like her would never want to be remembered not looking their best. Women like her only commit suicide in 2 ways. The only way she could do it is asphyxiating herself in the garage with a vehicle, or overdosing on pills. So she begged to be admitted. I trusted him. I don't know why, but I was desperate and exhausted and trusting the healthcare provider. And so I went home and I did what he said. I got rid of the car keys, I got rid of the medication. She found a sloppy way to do it. Another appointment was through a crisis center in Pittsburgh that had 24-hour psychiatric help. We got there and they saw her, and we waited all day. We were the first people there in the morning, 7 a.m., 1 o'clock, 2 o'clock, 3 o'clock comes around. They're leaving at 4, I think the psychiatrist, they finally call us back. The doctors left for the day, but you could talk to a social worker. We went through all these questions, and all they really did, no one listened to her. They just looked at her and judged her. Mm-hmm. And so what they did was find reasons why she wasn't going to do what she was telling them was going to happen. Are you employed? Yes. Do you have, are you financially secure? Yes. Do you have a safe home? Yes. Are you a woman of faith? My father's a minister. Okay. Are you educated? I have a master's degree. You're fine. Women like you don't have problems like this. Just go home and this too shall pass. Another visit, which I blame in large part for her suicide, was an appointment with her OBGYN where she was first prescribed an antidepressant in Zoloft without being screened properly for family history of bipolar or anything. And after she started taking, she was told, take it for 2 weeks and you're going to feel better. A couple days after taking it, she started hearing voices. She started hearing phantom baby cries. She started having suicidal ideation. And when she had a follow-up appointment with the OB, rather than change the medication, and she was looking into estrogen patches and other things on her own to try to help herself feel better, and it was, you're not a candidate for that. And so rather than change the medication, the OB doubled the dose. And 2 weeks to the day when she took her first Zoloft, she took her life. And so the inspiration from the intensive care unit at the hospital, I was super fortunate and blessed to tell, people about this crazy idea that we were gonna build this center that could have saved her. And it was, it's the shame of life, you never get to go back. But moving forward, I wanted to make sure other women had access to the care. And this is not care that women just need, it's care that women deserve. It's care that every woman deserves. Every human being deserves. And so, I'm proud to say today we have 7,800 square feet in West Penn Hospital with my wife's name on it. We've treated over 32,000 women since we opened in December of 2018. And most importantly, the program was built with the idea that we wouldn't just build it and do what we do, that we would constantly evolve. And we noticed a big problem with the children of the mothers that were suffering. And so in our program, the children are allowed to come to treatment with mom, not just the baby that mom had, but all children. And so now we're addressing the needs of the children that are growing up in homes of moms that are suffering. And then the Alexis Joy Foundation, my foundation, sponsored a program called the Partner Project, where we address the needs of dads that are struggling because mom struggles. And really, in its essence, maternal mental health is not just a women's health issue, it's a family health issue. Everybody in the home suffers when mom's suffering. And so I'm really proud of the work that we're doing, and we're just getting started. There's a lot more to do, but I think everyone in this room is in a way a pioneer. Fighting the good fight and doing, it's not a lucrative area of medicine. And, but it's the right thing to do. And my wife did not get what she deserved. But there's 32,000 women in Pittsburgh that have got the care they deserve because of that. And in my 12 years of advocacy, this is just what I've noticed, and I try to get involved with as much as I possibly can. But I think screening processes, I think there's a handful of things that would lead to better outcomes. Better screening processes. Our health system changed it in 1 week after they met me. Better access to care, which women in Western Pennsylvania have access to, and if you don't in the areas where you live, just point to Pittsburgh and say, why do moms here have access to this but we don't? Science is amazing right now. We have the first ever prescription drug prescribed for postpartum depression. And we have technology today that we didn't have back then. And I do work with one using, advocacy work, doing wearable technologies to detect problems before they become problems or earlier on, in a way that mom doesn't have to be desperate to reach out to mom, where doctors, it pops up on their computer, mom's struggling, things have changed, and they can reach out and say, hey, are you okay, are you struggling? So it's not this isolating, lonely process, scary process to get help. And so those 4 things together, I think, can really move the needle ahead quicker. I would ask you to all share my story whenever and wherever possible, to whoever's willing to listen, because my story is not, it happens every day, everywhere, in every city in this country. So I just feel blessed that I get an audience and I get to share them.
On our website and also a partner organization's website, there's the faces of mothers who have lost their lives to maternal suicide. And this week, I invite you to visit our website and take a look at those faces and bow your head in a moment of silence, light a candle, turn on the light on your phone to remember the lives lost. Thank you, Stephen. I did also want to end on a note of hope. I want to share that the American College of Obstetrics and Gynecology, because of stories like Stephen's and Alexis's, have since released guidelines, clinical practice guidelines, not just recommendations that can be taken with a grain of salt, but true clinical practice guidelines that recommend screening, diagnosis, and a separate set around treatment protocols. Recognizing that onset can happen in pregnancy, that a mental health history should be taken when pregnancy is confirmed, including family history, which could have saved Alexis's life as well. And then again, what are the most recent and important treatment protocols? How do we screen for risk for suicide? What about the new postpartum treatment drug? How do I prescribe that? So I want to just reassure everyone that we have some great change that has happened because of these stories. And with that, I also want to share one more piece of hope, and I saw you all looking at this screen here. We wanted to share that we are launching in response to all the great work of the Federal Maternal Mental Health Task Force and leaders in the room like all of you, a campaign that we're calling the 20 by 30 campaign, which includes 20 aims that we can accomplish together, cross-sector stakeholders, including you in the room, members of congressional staff and agencies, national nonprofits, prioritizing 5 policies, federal policies, 5 projects, so things that we need to do to improve the healthcare system that won't necessarily require policies change, and then look at 10 measures, things that we can measure in the health delivery system to see if we're making progress on maternal mental health. This framework will be launched through the National Coalition for Maternal Mental Health, again, organizing cross-sector players like all of you to move from concepts from the Federal Maternal Mental Health Task Force to action. I do also want to say we are not going to take on the role of the federal government. There are things that the federal government agencies in particular need to lead on, and these are the actions and frameworks that we know will require outside federal agency commitments. So we invite you to learn more about this project as we move on in our work together. And with that, I want to thank all of you and thank our speakers and sponsors for an incredible evening. We encourage you to connect with all of us, connect with our speakers, and learn what you can do to move the needle on maternal mental health. Thank you all for coming.